The first nursing intervention is to assess the level of anxiety and use relaxation techniques. In the initial assessment, Ambrose has a lot on her plate with being a single mother of two and a nursing student. The assessment could be a series of questions inquiring about her everyday life and how it affects her anxiety. The response could be on a scale of 1 to 5, with 1 being the lowest level anxiety and 5 being the highest level. We can then take this information and compile a plan of action for ways to relax, for better cope with anxiety. Another intervention is through the use of education. Teach the patient on ways to be able to manage her stress and health effectively. This is closely related to the first intervention. Focusing more on the stress management portion, we can give suggestion on activities that manage the stress, such as exercise or meditation. Some of these resolutions could be things that Ambrose never thought to do and could be brought to her attention. It would be important to emphasize that stress is not a good thing and could bring multiple negative medical complications, as well as affect the quality of daily tasks and obligations.
Another intervention we are including for our plan of care is for clients with chronic insomnia. We're going to speak to a provider trained in cognitive behavioral therapy for further interventions. Our patient has struggled with falling asleep and staying asleep for a period of over 6 months, classifying it as a chronic condition. It has come to the point to where it is negatively affecting how she functions in everyday life. These interventions by the physician may include medications or therapy. Lastly, we included teaching the patient how to avoid negative association with the ability to sleep. According to La Roche, fear of not sleeping can interfere with sleep initiation and maintenance. Ms. Ambrose keeps track of the hours she sleeps and negatively associates it with her mood and ability to function throughout the day. She worries that this constant inability to sleep will lead to dangerous events occurring with her job. As mentioned in the case study, she says a silent prayer that she would not harm anyone during her clinical shift. All of these negative thoughts may be causing her ability to fall asleep to be even further impaired as her stress and anxiety build. Ms. Ambrose may want to avoid these negative thoughts, but needs the right guidance in helping her to control them and avoid keeping track of her lack of sleep.